Hi, my name is Laura Klosterman-Feld. I am a nurse practitioner at Regain Functional Medicine, and today I'm here with my patient Bruce, and we're going to be doing PRP hair restoration. So we're going to actually draw out your blood, and the one thing that we want to make sure we're doing is that you're well hydrated before the procedure. One thing we also make sure we tell our patients is that they do not take any blood thinners before as well. What we do is we pull out the platelet-rich plasma from the blood. We spin it all down in a centrifuge. We then take the plasma and we inject it, and after we've numbed the head, into little areas where we're trying to focus for hair regrowth. After applying some topical numbing cream to his head, we usually let it set about 10-15 minutes. And during that process, one of the things we do is we actually spin down his red blood cells and pull out this beautiful plasma and pull it into these syringes. And we also add a little bit of lidocaine, which also helps with the injections as well. The next step that we're going to do is actually inject in the areas that we need to actually focus on and make little wells in the scalp to actually help regenerate that hair growth.
Hi, I'm Bruce, and I received the PRP hair restoration from my nurse practitioner Laura, which was a very painless procedure of about an hour. I am recommending it for anyone who is looking for more hair growth. I'm excited to get the procedure done next month and continue the process to see how much comes back of my hair growth.